task force, basically as soon as this began, over 4 months ago, Rabbi Heller shot up a flare immediately and said, hey, should we get together? This might be really bad. Should we at least start to talk? And we have met formally every 1 to 2 weeks, consulted via email as needed, used Slack quite a bit to address time-sensitive issues. The group includes our rabbis and Natalie, our executive director, myself, Jason Adler, our executive vice president, and 4 experts. Dr. Lisa Bernstein, she's a professor of internal medicine who treats COVID-19 patients and is helping lead the reopening of the School of Medicine building at Emory. Dr. Howard Cohen, who's a professor of infectious disease with decades of clinical experience. Dr. Mitch Garber, our ritual committee chair, is a physician with a master's degree in public health with a second master's degree in engineering. He is monitoring COVID-19 response for an engineering consulting company. And Dr. Lisa Coonan, an epidemiologist and nurse practitioner who has over 30 years of experience at the CDC, Center for Disease Control, in a national pandemic planning and emergency response, including the past 4 months on the CDC's COVID response team. So we're currently in phase 1. We pulled this chart directly out of our reopening guideline or plan or hope. And the challenge with, as Rabbi Heller mentioned, and I'm sure Mitch is going to touch on more, is we hope the next phase we go to is phase 2 because we're in phase 1, but there's also a possibility we could go backwards to phase 0. So to highlight a few things currently in phase 1, obviously face coverings are required. It's not a political statement. It's purely a statement based on data that Mitch can touch on. Physical distancing. We don't use the word social distancing. It's actually physical distancing. In-person attendance, we would track it. For life cycle events, there's going to be a limited entry into the building. Even for if we were able to do some outdoor activities, there'd be limited. We are absolutely doing enhanced cleaning. All pastoral appointments currently are virtual with one of our rabbis, and there's a couple other things that we're not even discussing yet because of just the current way that I guess the world is right now. You can go to the next one, Natalie. So here's what we're going to be discussing and give you a little heads up and also a little bit of what we're not really going to be talking about. We expect that religious school will be largely virtual through the high holidays, and we will expand our in-person based on the phases described in the documents. There is a link to the documents on our website if you don't have it. Certainly you could reach out to Natalie. She'd be happy to send it to you again. It is pretty lengthy and pretty intense. When we are able, we'll have in-person kind of meet the teacher sessions, and then we'll move to a hybrid model where a few classes will rotate having time on campus each week. Elizabeth Block will be sending more information to our religious school families. Preschool is currently slated to begin in August, and we have developed protocols to protect students and staff. We're currently communicating with families to get their feedback. Once again, we will modify plans if state regulations, local conditions, and the safety of our community require it. Please reach out to Alana Bernstein if you have any specific questions. The High Holiday Task Force is working to make sure the high holiday experience is meaningful for all. Okay, we received over 400 responses to the survey we sent out, which we're greatly appreciative of. We're still culling through some of that information. I mean, it just closed a week ago, and we're using that information to help guide us. We're not going to be discussing individual life cycle events this evening. Once again, much of that is going to be determined by which phase of reopening we are in. We can give a broad overview, but we can't answer specific questions about your upcoming event. Should you have a specific question regarding an upcoming life cycle event for you or your family, we ask that you please reach out directly to Rabbi Heller and or Natalie. And I just want to remind everybody that the statements made tonight by Mitch are being made based upon his role as a member of the COVID task force and as a member of the board of directors. Okay, so with that, one of the smarter, more and also very funny individuals I've had the pleasure of working with on a couple of task force, Dr. Garber.
Thanks, Roger. It would be even better if I was trying to be funny when you're laughing at me. So I've only got a couple of slides, and I think Natalie's going to move me forward into those. I just want to talk about kind of where we are. And by the way, just so everybody knows, I'm happy to answer any questions, you know, about the science, about the background, about why we're doing certain things now that we weren't doing before, just in general. But I just want to kind of give us a picture of where we are and how we got here. So these, you've probably seen these curves. This is the number of cases per day by date in the European Union in blue and in the United States in red. So it shows you what happened in March, where we really started to see a lot of increase in the numbers of cases in Europe. And then shortly after that, 2 to 3 weeks after that, we start seeing the same thing here in the United States. What you see with the European Union is that a lot of cases very rapidly progressed into the epidemic. And then as they locked down, they saw those case numbers start to drop. And as those cases started to drop, they very, very slowly, very, very gradually, and they're still in that process, are trying to see how they can open up safely. They're not, they're being cautious, and they're closing down areas that they're still having problems in when that doesn't work for them. The red line, which is us, which is the United States, we had a very similar experience initially. That is to say, we had a fair amount of closures. We started to see our numbers drop down significantly, and they did in fact continue to drop for a couple of months as we, you know, as more and more states put restrictions on. Then once we started opening up again, we started seeing that curve flatten out. And as you saw more extensive return to, you know, what I would say more previous behaviors, started to see our curve rise, and it's rising now very, very rapidly. It's rising exponentially because once you've got all of these cases out there in the community, there are more people to infect more people, and so we start to see that rise very rapidly, and that's where we're at right now. Right now, we're seeing in many, many states throughout the United States, we're seeing this very rapid rise of the epidemic curve. So we'll go to the next slide. And here I just want to show you what it looks like. This is the same, the red is that same curve that you saw for the United States. These are the number of cases that we're seeing now coming up, increasing pretty much day to day. What's more concerning, because obviously, you know, just having cases isn't the problem. The problem is what happens to those people. And so what we've seen is with about a 2 to 3 week delay from the time that we start seeing our cases rise, we've started seeing our hospitalizations rise here in the United States. And so as those hospitalizations rise, they're going to follow that same curve. So we're going to see a fairly steep and sudden increase in hospitalizations. And we can go to the next slide. So what's happening here in Georgia, because this is more important to us individually here at B'nai Torah, which is that we're seeing our positive tests go way up. And we're doing a fairly good job of testing. Our number of positive tests has more than tripled in the last 3 weeks. So we're seeing a real significant increase. And you've heard some people probably say that, well, this is because we're testing more. And that's not the case, because when you look at this lower graph, the lower graph is the percent of tests that come back positive. And what you saw initially was there a very high percentage of tests was coming back positive because we simply didn't have enough tests to test all the people we wanted to. As we got better with testing, the percentage of positive tests came down. So the more testing you do, typically the percentage of the positive tests comes down. Even though the total tests may go up a little bit, the percentage is coming down. Now we're seeing the percentage go up at the same time that we're seeing our positive tests go up, which means that we're seeing a real and significant increase in the number of positive tests out there. We can expect here in Georgia that we will see an increase in hospitalizations. That's just starting to be seen now, and ultimately in severe outcomes for people. So that's our concern. That's kind of the background against which we're operating. We recognize that that there are things that we can do, and we're cautious about figuring out what we should do. So with that, I'm going to kind of, I guess I'll feed it back to Roger so that he can maybe say a couple more words and open it up for questions.
Well, I'm actually going to toss it to Natalie as kind of, she's going to play our moderator and kind of field whether you want, if you want, you can type questions in the chat box. We have a couple of people monitoring the chat box down at the bottom of your screen. There's a little cloud that you would speak into that's called chat. You could type into that to everyone. You could send it specifically to Natalie if you'd prefer. We did get a few questions in advance of tonight, and we appreciate that. And we're going to do our best to answer all the questions.
Thank you, Roger. So we got quite a few questions ahead of time, and a number of those had similar themes. A number of them were things that Roger's already discussed that we're not prepared to discuss right now, which includes mitzvahs, religious school, high holidays. Obviously, we're working really hard to get you those answers thoughtfully and briskly. But looking at the chat, I know a question just came through that questions what determines, Mitch, when we move from one phase to the next, whether it be forward or backwards.
So there's, and if you look at the actual plan, you'll see that there's some specifics in there about what that's going to be, and I'm recalling it off the top of my head right now. To move forward, we're going to have to see at least 2 weeks of continuous decrease in the number of cases. We're going to have to be confident that we're not stressing our resources with regard to hospitalizations and things like that. And then we're going to have to make, we're going to have to be comfortable, those of us in the committee are going to have to be comfortable that we're not doing anything that would significantly increase the risk either in the community or to the B'nai Torah congregants before we move into a less restrictive phase. So that's, we're right now, we're not anywhere close to doing that just because the cases are, as you see, quite rapidly rising. So we're not in a position where we're likely to, in the next week or so, move into a less restrictive phase. We're hopeful that we may be able to have that opportunity as we move forward, but we don't have, right now, we certainly are not anywhere close to entering phase 2. If anything, we may be closer to in danger of sliding back to phase 0. We're watching all of that carefully, and if it becomes a situation where we have to limit or restrict what we're doing now, which is already quite limited, then we'll be doing that as well.
Thank you, Mitch. That actually covered another question in the chat, which related to the idea of moving backwards. A number of questions came related to when we get to the point where there's a comfort level to begin re-entry into the synagogue. What will that look like related to permitting individuals with or without mask, as well as not being aware of the additional comings and goings that said individuals may be doing in their own personal life, Mitch?
So if I understand the question correctly, the issue is once we do get to a point where we're able to be back into the building, where we're able to be a little less restrictive, and again, I want to emphasize that I don't think that's next week or the week after. I mean, we're looking at down the road. Once we do get to that, what are our restrictions going to be? And again, I think the plan covers these in a fair amount of detail. In all of the near phases, we will be requiring people to have face coverings. I don't like the term masks. I always think Batman. But I think what we're looking at is face coverings, and the idea is that we're protecting those around us by doing that. So we will be requiring that. We'll be requiring people to have those and bring those. We will not always be able to supply them. And so we're going to be requiring people come to the synagogue with those. There'll be a number of other interesting restrictions for those people who will be coming. It'll be the numbers, obviously, will be very restrictive initially. We're going to very strongly discourage folks who are in high-risk categories from being any of the first folks that come. As I think the questioner notes, we can't say what people will do outside of the synagogue. And so one of our philosophies on the group here, on the task force, is that initially we will be treating everybody as if they're infectious. So our policies, our protocols, our distancing, our face covering wear, all of that, everything will be designed as if every single person coming in is infectious. Okay, we're going to be trying to make sure that we're protecting folks because we don't want to take the risk that someone who is infectious comes in and starts infecting other people. So everything that we do moving forward, assuming that we're able to do that at some reasonable time, is going to be to prevent a person who is infectious from infecting others. Okay, we're not always going to keep somebody out who is infectious, but we're going to treat everybody who comes in as if they are. And that will save us in the long term from running a risk of communicating the disease within our congregation, within our community.
And let me really briefly add, when we first started doing virtual services and virtual Shabbat, there was typically 2 people in the sanctuary at the same time. And we determined, based on some of the advice from Mitch, that we were being too close. And even though we were staying 6 feet apart, we were wiping down stuff, the benefit wasn't there to have a second person in the actual sanctuary at the time we were having services. It's that challenging of a disease, and we don't know enough about it. So we determined, because it's nice to have some help and another person in the synagogue when you're running services, but we determined that it just, the juice wasn't worth the squeeze. So
talking to my colleagues in clergy, a lot of different houses of worship have a lot of different approaches, but the research that has come out, and Mitch may want to say more about this, is, that being quiet, you only emit so much of the air. People now think this is, what, Mitch, you have more slides, don't you, about aerosol? You're not doing the aerosol stuff, right? No.
No, but I can address that.
You talk about singing and talking as spreading things.
So I can, yeah. So let's one of the things that we found, I try to make the point pretty much every time the task force meets. We don't have these binary decisions. It's not like 5.5 feet is okay and 6.5 feet is not. Okay, it's not like there's some sort of line that we can draw that says that this is safe. What we know is that being farther away from people is better than being closer to them as far as our risk. We know that wearing a mask reduces the risk beyond being unmasked, but it also means that everybody has to wear it. We know that having fewer people is better than having more people. We know that being outside is better than being inside. We know that having good ventilation is better than having poor ventilation. We know that things are better or worse, but we can't say that there is some specific line that says it's okay. And so what we're trying to do is to maximize those things that we know are helpful and to minimize those things that we know are harmful. 6 feet is not a magic number. You'll hear that a lot. The virus doesn't know from 6 feet. So there's no magic a barrier that stops it at 5.9 feet. It depends on what you're doing. Coughing, singing, clearing your throat, yelling, talking loudly, friends.
Basically
Yes.
anything I do.
Anything that Rabbi Heller does is going to be more likely to transmit this. You're hearing a lot of talk now about aerosolized versus non-aerosolized. I think that's probably not really even a necessary argument to be having, because what we know is that the farther away you get, the safer you are, and that the more you do things to expel stuff, the worse off you are. We're having a long discussion right now about blowing shofar. So there are going to be a lot of things that we normally do in a synagogue. All the things that make our sanctuary service, singing together, sitting together, touching each other, greeting each other, eating together, all of the things that make that being together as joyous and spiritual as it is are not going to be available to us initially. We're not going to have that when we first start returning to the sanctuary. And so all the things that make what we do fun and joyous and spiritual are many of the same things that make it risky. And so we're going to be, as we come back, the in-person portion of the services will probably look a lot less like what we were doing before than the online portion does. So
I want to address a question that was submitted ahead of time. It's probably as much for Rabbi Heller as for Mitch. The individual notes, if there must be 10 people in person in the sanctuary to read from the Torah, who will determine who these people will be? The highest bidder, question mark?
So we've spent some time thinking about that question. So I am on the Committee of Jewish Law and Standards. Everyone needs a hobby. So when we posed that question to the conservative movement, it actually ends up back on my desk. I have been having a vigorous debate with my colleagues about the questions of remote Torah reading. I am going to spend part of my vacation next week coming up with an answer. But I think the question of having 10 people in the sanctuary is a little bit further off. What we've talked about is how we allocate fairly between, say, the bar mitzvah family, if there is one, and the people who we need to run the service. And if there are only 10 people in the room, that's probably everybody, right? Between basically by household, if you have 3 or 4 households in the sanctuary to make a minyan, you have the bar mitzvah family and maybe one other grouping from that and some people to lead the service, and that's everybody. When we get to have 50 or 200 people in the sanctuary, we should all live that long, then that becomes a much more interesting debate. But it is a great question, and it's a gut check in terms of our values. And the answer is that we are a diverse community, and we want to give people the chance to come in, but precedence is to the people who actually need to run the service. What I will tell you is, for the first while that we are in the sanctuary, it will not be fun. It is not fun wearing a mask for 2 to 2.5 hours. There's all kinds of details about just how we do it, right? And sitting 20 feet away from the nearest person. So I think a lot of people, after they do it once, may actually want to go back and sit at their desk again until things get a little bit further along.
Thank you. Mitch, another question that was posed ahead of time related to age, and if there would be restrictions related to the age of an individual.
Yes, anybody who behaves like a 4-year-old will not be allowed in. So my wife says that's me and Rabbi Heller. And I added Rabbi Heller. So we're not, our plan does not prohibit people from attending, once we get to the point that we're actually having people physically in the sanctuary. It doesn't prohibit people from attending based on age. But we recognize that there is a significant risk associated with that. What we are doing is we are strongly encouraging folks who are at higher risk to not be in the sanctuary when we start initially having people back in there. Again, a lot of it's going to take care of itself. Initially, we're going to have, who's ever leading the service, who's ever participating in the service. Those folks may have to be there. I will tell you that if you are comfortable wearing a mask and sitting for 2.5 hours away from other people, not being able to schmooze, leave, or go to the restroom, then you are probably younger than I am, and not older than I am. So I think that we will we'll probably see, I don't think there's going to be a situation where we're going to have to say, no, you can't come in, but we may, I think we are still going to continue to try and discourage people who may be at significant risk. The very last thing that anybody in the congregation wants to have happen is for us to be the cause of one of our congregants becoming ill.
Thank you. Are there questions from those of us who are attending today? If you want to maybe raise your hand or unmute, I'd be happy to call on you. Fred, why don't you unmute?
Okay. So to the point of B'nai Torah members and their own individual health. So I have a couple of questions. Number one, do we have something set up for members who may have tested positive to communicate that to someone at the shul? And, Mitch, you looked at the US numbers and Georgia numbers and trends and the impact that those trends might have on what we do in terms of our plan and phases. Is there any part of this that may be premised upon our own localized, status of our health? So internally within our community, will that play any part in these discussions, these decisions?
So I think the simple answer to your question is no, and the reason for that is that those data are not going to be data that we can come by. We can't, I suppose there is we could build an NBA bubble where we put everybody in the congregation in 4 hotels, didn't let any of them out, and tested them all every day. But I don't think that anybody would allow us to do that. I think the problem is that the data on the state level is probably good. The data on the local level is okay. When we start trying to look at individual data, it becomes very difficult, particularly given that a significant portion of people will be asymptomatic, particularly in the early phases of the disease, and will still be able to spread. And so we don't have the ability to narrow down to our individual risks and somehow calculate what that's going to be for all of our congregation. We're really working, we're working off of the numbers that we have and making our best guess about what that means about our community. One of the things that we are hopeful of and believe to be somewhat true is that ours is a community, ours is a congregation that is probably pretty well informed, probably largely better informed than much of the rest of the community around us. And right now, our hope is that because we're offering services in a way that allows people to get their spiritual fulfillment, but not have to be in large groups, that we are actually reducing that risk and that our population is experiencing less of this than others. our goal is to keep it that way.
Right. And I will say on a pastoral level, I am aware of congregants who have been tested positive, not had symptoms, tested positive, had symptoms, been in the ICU, passed away. But those are anecdotal, right? It's one person at a time. It's 3 people at a time. One of the things that we will do when we have people coming in any numbers is contact tracing, which means that anyone who is involved in anything we do, we will have to know who they are. And, you know, if we find out, and the state does this, right? If we find out that someone who has been infected or exposed has been in an activity, there are steps that we will follow based on the level of exposure, how long it's been, and so on. And those are laid out in general in the plan. And Fulton County Health Department also has procedures to follow if that happens. That may change over time, but in other words, if we are aware that we have a service and someone there tests positive 3 days later, that we can't tell everyone, oh, Joe got you all sick, but we have to inform everyone, someone at that service here's what you should do next.
And I should say that prospectively, we're hoping to be able to do that as well. In other words, if we have people who are planning to come to our services or planning to attend our services once we are doing that again in person, that if they have a concern about a potential exposure, I'm making myself available as a direct resource so that somebody can call and say, hey, I walked past somebody while they were walking their dog in the park and they kind of coughed a little bit. Is that an exposure? Or, hey, I was in Arizona and inside a mega church and there were a lot of people coughing. Is that an exposure? We have the ability to actually do this. I think it's especially initially when our groups are small on an individualized basis. We can actually assess whether an individual may have done something or may be in a position where they may prefer, in order to keep the risk low for everybody, to come in or to get tested before they do.
Thanks, Mitch. Another question's come through the chat. I'll read that. When attendance is allowed, do you have a plan to rotate Sidurim, Talis, Kippot, etc., so that a few days go by before a day's items are again handled?
So yeah, actually we do. Our preference is for people to bring their own, and I think that's actually set out in the plan that our preference is once we've got people coming in, is that they're bringing their own Sidurim, their own Kippot, their own Talitot. But we also have we certainly have way more talises, way more Sidurim than we will need initially. And the great thing about this is if we leave them sitting somewhere for 3 days, there will not be any active virus on them. So we're quite comfortable and confident in that. We're not really having to, we're also talking about, haven't put it into physical place yet. We're also talking about having two separate sets of seating so that we could do a Friday night / Saturday morning separately and not have to, clean seats or anything. They just won't be used on subsequent days. So we have more resources than we are going to need in that regard over the initial phases of this.
Thank you. Other folks with questions, if you want to unmute or maybe raise your hand. I realize I should look at the second screen as well with my little laptop. Oh, Keith, unmute.
Okay, I'm unmuted. So just a question I'm throwing out there. On a sunny day, on a Saturday, is it a possibility that we can use our parking lot, assuming we don't have a huge crowd, and have services outside and maintain distancing as much as we need to? We got a pretty big parking lot, but at least get together for something like that at least once. Is that a possibility?
So this is a discussion that we've had amongst the group as well. And the answer is, I think, not right now. Again, it's not a matter of maintaining it's not just a matter of maintaining distance. So let's say we put 50 or 60 people in our parking lot. Where do they go to the restroom? You know, what do they do? What do they do when one of the children runs over to another one of the children? How do we work people getting in and out of our parking lot while we have people standing in our parking lot? You know, I mean, we've had these discussions, and our hope is that we may be able to actually do some of that as we move a little bit farther forward in the phases. Certainly right now, and probably for the next phase, that's going to be more than the task force is comfortable with, and there's just too many. Part of it is trying to deal with the logistical challenges of telling people, okay, now you can go to the bathroom, but you can't, or you know, you can't go in the. Once our risk level goes down, we're willing to put some time and effort into addressing those logistical challenges. And we've already started putting together plans for those types of events, but we're not there yet.
Right. I'll also throw in, we did some test events. So I have done some socially distanced outdoor bar mitzvahs. And what I can tell you is that people are not good at social distancing, or at least weren't in the trials that we ran. And so what would happen is that, you know, I might be standing over here wearing a mask, but within 10 minutes, the masks are here, the masks are here, people are like schmoozing, hugging, table hopping. So part of the challenge is not just the theoretical how you could do it, but whether you can do it and will actually work. And that's what I've heard from colleagues as well. So I think when we sent out the initial thing, we also sent out an invitation. If people would like to be part of future test events of parking lot or socially distanced activities, please write to me. We are keeping that list. And so the first couple of times we do that, it will not be announced congregationally, everyone show up. We are compiling a list of the people who are willing to be guinea pigs in a small enough group. And if they can do it well, then we'll expand it out to the larger congregation. So let me know if you want to be on that list.
Thank you. Okay, another question in the chat. I'll read it. Do you now and or will you in the future take the temperature of employees on a daily basis? Are there plans for using no-touch thermometers to take temperatures of congregants before entering the building?
Okay, and this was something that we very specifically discussed in the task force as to what the value was of actually taking temperatures. One of the problems is that, and I'll quote some of the studies that we've looked at. So in New York, there was a study that looked at people admitted to the hospital with COVID-19, people who were actually sick. Of those people, less than a third actually had fevers. So one of our problems is we don't want to start giving people the idea that as long as you don't have a fever, you don't have the disease. The other problem is that in order to take temperatures, we're going to have to put somebody close enough to get to your forehead. And if we're going to have somebody close enough to get to your forehead, we're putting them at risk. So we don't necessarily want to have a screener with every single person who's walking in the door, getting in contact with every single person who's walking in the door, and then say everybody should be much farther away than we just had you with the screener. So we're actually, we believe that the odds of finding an asymptomatic person, someone who feels fine, but has a fever and who doesn't know it and who's coming into the shul and who hasn't taken any medication to reduce their fever, is lower than the chances that we're putting the screener at risk. So we're balancing the risk to staff versus the limited potential benefit of temperature screening. We had, in the period of time that we were screening every single person who came into the airport in LAX, we found one case of COVID-19 out of 30 or 40,000 people that came through the airport in that period of time, we also ended up missing 11. So it's not a particularly good screening tool, and we don't want to put our staff at risk in order to have to be in the face of everybody who comes in there, who may have no fever, but may actually have SARS-CoV-2, the virus that causes COVID-19.
And I'll just add real quickly, some of the things that we did discuss on the task force is that it can give people a false sense that they're fine. And the Georgia legislator demonstrated this very well when they were initially early on meeting, and they would get their temperature checked and they were fine, and they were walking past where the temperature screening was and they were high-fiving each other because they were fine and their temperature was okay. So we don't want to set that false sense of security. And then another question that's been asked a couple of times is, well, couldn't the Sandy Springs police be the people who administer the test? And the answer is that wouldn't really be good, because we really want them to protect us and protect our building. We don't need them to be taking people's temperatures.
And by the way, we don't want them to get sick either.
Right.
Thank you. Other questions, guys? Raise your hand, unmute, do a jig. Tracy, are you trying to unmute? No, I'm picking on you. Okay.
Mitch is a real expert. Now would be a good time to ask him a question if you have one.
I will say that someone actually submitted, so Roger, to that point, someone did ask what and where is safe, what activities are safe. I don't know, Mitch, that you can answer that in a way that is not a 12-hour answer, but I don't know if you want to maybe do a high level for those of us who are not meeting every week with you to kind of give us an idea.
Yeah, so I mean, look, being at home, being with folks that you know are not infected, that's safe. We're confident that if you're at home with a group of people who are not exposed to other people, that you're not going to end up with the virus. Beyond that, it's a matter of how much risk. There is relatively, if you are masked and I am masked and I walk past you in a grocery store on my way down the aisle for just a moment, there's not much risk in that. If neither of us are masked and we stop and we chat for 25 minutes and clear our throats and cough, that risk goes way up. So a lot of it is making sure that we're taking sensible precautions in the things that we are doing. Many of those things are going to be, I tell people, somebody said, well, is golf safe? I said, well, if you're the only one in the golf cart, yeah, it probably is. If you're there with 3 of your buddies, probably not so much. And so a lot of it, this disease, and you're going to hear a lot of different things about this, but by and large, the vast majority of disease transmission that occurs with COVID-19, that occurs with the virus, SARS-CoV-2, occurs person to person. I have to breathe in what you breathed out. Okay, if you can avoid doing that, then you're not going to be at significant risk. If you are amongst 200 people who are breathing out and you are breathing in, you're going to be at significant risk. And so we're trying to identify where the areas are that we can safely do things, recognizing that we have high-risk people in our congregation, recognizing that, we're not all as young as Natalie and Roger, that it is going to be a matter of managing to both manage what we can do safely and what we expect to do. I keep telling people this is going to be a very different experience once we are back in the sanctuary. And frankly, I don't expect it to be much fun. Because in order to keep that risk, sorry?
I said even less fun than it was before?
Well, yeah, I mean, it depends on which rabbi is leading, but but it is going to be, if I could get every person, every human on the planet to stay still and masked and 20 feet away from each other for 2 straight weeks, we'd be done. But I can't do that. And so we have to manage the fact that there are going to be people who are going to be taking more risks than the rest of us, that there are going to be people who are, and who may need to, who may have to because they are first responders or they are medical professionals or they're in a situation with family that they must in fact travel or go to a place that they know the risk is higher. So what we're trying to do is manage not just an individual's risk, because that's easy. Okay, it's easy to say, I can keep, if I could, and he keeps breaking out of it, but if I can put Rabbi Heller back into the bubble that I started him in, then he's not going to get infected. But we're trying to, as a task force, keep 800 plus families safe. And it's not just one person or another person. Those are easy. It's easy to tell somebody, what can I do to keep you safe? What can I do to keep me safe? The question is, what can we do to keep our community safe? And that requires our community to do things that we're not accustomed to. And that's the hard part. That's the thing. That's why we're seeing these numbers go up. That's why we're seeing this huge increase right now, is because people have had it. They're done with it. They're over being at home. They're over, having to watch their kids run around and not their friends. They're over not hugging people. But the virus isn't done with us. It's not done with us. We may be done with it, but it's not done with us. Now, I will say, I do want to, a lot of times I get accused of being the voice of doom and gloom in the task force. But I do want to say something, which is this. I always say I hate making predictions, especially about the future. But I will say that based on what we're seeing with vaccine development, based on what we're seeing with that, I do believe, and this is just me, I'm not speaking for the task force here. I do believe that by next summer, we will be done with this. Okay, we will be in a position where we can say, look, we can do the things that we used to do. Now, we may also find that a lot of things we used to do aren't as much fun anymore, and we actually kind of like the things we're doing now. But I think that we will be there. There is a concerted effort by the folks who know what they're doing in vaccine development, in treatment development. I think that by this time next year, we will be able to do a lot of those things. Up until that point in time, and it may be before then, it may well be before then, but until we get to that point, we are going to have to get used to doing things differently in order to protect our community. It's not that I think I'm going to get COVID-19 if I go to shul. That's not what I think. What I think is that if everybody goes to shul, then I know for sure that we will be transmitting it in our synagogue. I may not get sick. You may not get sick, but somebody will. And more than one person will. And once we've got multiple people sick in our community, then we are part of the problem. And both from a religious and spiritual perspective and from a scientific and medical perspective, we can't really allow that to happen. We have to not just protect ourselves individually, but to protect our community, to take responsibility for all the people that are here and the folks that we're not seeing here that we don't want to harm. And that's the hard part. That's the really hard part.
Thank you. Mitch, I want to end because that was a great closing, but I have some other stuff in the chat, so we can't.
No.
Okay, so a couple things out of the chat. One thing just to note, we do have our reentry plans, which include our phased chart on our website. You are welcome to go check it out. We will certainly keep the congregation apprised as we move from phase to phase, albeit forward or back, and reminding everyone what that means. Another question came through, Mitch, related to testing. Hold on one moment, let me scroll up. Okay, a question came through related to the saliva-based COVID-19 test, which the FDA approved and is available for fast, same day, or 15, I believe, minute results. And I wondered if you could talk about the committee's thought on the rapid test.
Yeah, so let's just talk about what it means to have FDA approval. What that means is the FDA has said that that what you're doing isn't going to kill anybody, and that it meets some arbitrary specific standard that the FDA has set for it. It doesn't mean that it's 100% accurate. What we're confident in, what we're comfortable with, and even it's not quite 100%, but what we're confident and comfortable with generally is the accuracy of what we call the PCR, preliminary chain reaction, nasal or oral swab tests. Those have proven to be pretty accurate. We like the results and the ability to use those. The other ones when we say how accurate they are, we're basing them off of the PCR swab tests. So we're not. There is testing. I think we're going to see additional testing come online, and there will be additional types of testing that will probably prove to be useful. We've been doing, and I'll use this as example, we've been doing rapid tests for strep for many, many years now. Most places that do it will still do a strep culture because we still miss a lot of cases by doing rapid tests. In this case, we really can't afford to be missing many of the cases, so we want to use the most accurate tests that are out there. Again, we're not the synagogue is not going to be in the business of testing people. But if anybody asks me specifically what test they should be getting, I am recommending that you get a PCR nasal or oropharyngeal swab test in order to make sure that you're comfortable with the results of that. I also try to make sure that people understand that getting exposed today and getting tested tomorrow is useless. If you get exposed today, your test will be negative for the next 48 hours, unless you were positive before you were exposed. It takes about 5 days before that test is going to reliably be positive. And so getting tested, I've seen situations where people have said, oh my gosh, I got exposed at this. The next day they go and get tested. They say, oh no, I'm fine. You're not. You don't know yet because you haven't let the time pass that it takes for the virus to actually disseminate in your system and the test to become positive.
Thank you. Another question coming out of the chat, Roger, I'd like to throw it to you. The question is this impacting the shul financially?
So it's a little early to tell. We waited. It's impacting because we postponed sending out our due statements probably 6 weeks later than we normally had. We weren't able to have the same effective Shomrei Torah campaign that we've had in years past because we were focused on other things. So is it affected? A little bit it's affected. I would say that, it's a little early to really know whether and how much. The good news is that we rolled into our fiscal year, and our fiscal year starts on, what is it, June 1st or July 1st? June 1st? Okay. We rolled into this year in a really, July 1st, that's what I meant to say, on a really strong financial position. Okay. One of the better ones we've had coming out of the 2019-2020 year, which is great. So we do expect probably to collect 15 to 20% less dues this year. And, it's going to be a challenge, but we also, we're hopeful that people see the value that our shul is not closed. Right now, it's just different. And we're figuring out and working hard to make sure that it's still meaningful for everybody.
Right. And I'll also just throw out there, we won't know whether that number is 15% or 30% on the dues until we know. But we are also doing some aggressive fundraising, a lot of it behind the scenes. Our Sefer Torah program, so far, everyone from last year has re-upped with one exception, and we have a number of new participants. So there are people who have committed to putting $10,000 or more behind the synagogue to keep us going. And so if anyone here would like to do that, would love for you to do that. but or any amount makes a difference, right? There are actually a couple of people on the screen who I see who have, and we are grateful. But it increasingly, we know that dues as a model of how you run a synagogue will be less important than people giving voluntarily. And this is just accelerating a lot of things that we already knew. We were already looking at streaming services before any of this happened. And now we know this saved me like 6 ritual committee meetings, right? That's the only good thing that came out of COVID is, right? We basically started it on a Thursday. All right, we're streaming now. But there are a lot of ways that life is going to change that we can't totally see yet, and hopefully for the better. But the finances of the synagogue, I would like for my paycheck to not bounce, but I think we're trying to be very responsible about how to do that.
Thank you. Homa, it looks like your hand is raised. Did you want to unmute and ask a question? I can't see your face. I see the blue hand.
Yeah, no,
Oh, you muted again.
I said I already got my answer. Thank you.
Very good. Okay, great. Thank you. Oh, Kenny and Sharon, Mimi?
Yeah, hi guys. This question is for Mitch. Mitch, it takes so long to get a test. It takes forever to get an appointment, and then it takes forever to get the results back. How long will the test be positive if you're sick? I mean, how long will it be accurate? And also the other question is, do you recommend not getting a rapid test? Because people want to find a rapid test so they can know right away. But is it not as good? I may have missed that. You may have already touched on that. I'm not sure, but.
Yeah, I mean, I think I probably danced around it a little bit, but yes, I think the answer is the rapid test is not as good. And so I will tell you in my workplace, we are not using the rapid test for folks who have been potentially exposed. So we're not comfortable enough with that. You're right that the tests are getting harder to come by. There was a time when you could literally walk up to most of the test centers and get a test. But because of the dramatic increase in the number of cases, the tests have been harder to come by, and they are taking longer to process. The good news is, good or bad, I don't know. If you wait until 5 days after exposure, you will probably remain positive for a good couple of weeks. I mean, the time frame is not tiny. It's pretty extended, during which we think people are going to be. And if you test negative, there's a pretty good chance that you're no longer infectious, which is probably just as good news anyway. So I'm hopeful personally that we're going to see an expansion of our testing capability. But I think the numbers, getting the numbers down is very important in trying to make it possible for us to do the testing. We're seeing about 15%, I think, positive testing now in Georgia, 10 to 15%, and anything above 10%, you start realizing you're going to be missing a fair number of cases, and so that makes us very uncomfortable as well. And as you say, it's not going to be helpful if you can't do contact tracing if you don't get the result back if it's a week before you get the result back. So you've already gone on and infected 3 or 4 other people. So
exactly,
yeah. We really do need to be able to get the numbers down. It's one of the reasons why we are concerned and to a certain extent expectant that there will be more restrictions coming from state and local governments. And as that happens, we, of course, at B'nai Torah are going to have to not just comply with those, but in many cases, we're going to be anticipating them and be increasing our restrictions as we need to.
Thank you.
Thank you, Mitch. Another question in the chat related to the incubation period. As you note, it's 2 to 14 days. What are the chances that you may get sick or have symptoms after 14 days? And
yeah, so
sorry, Mitch, the only other thing I'd add related to the question is I think the concern may be, what if it's 17 days before you start to exhibit something? Is that cause for alarm as well?
So I think the data that we've seen, 14 days is actually pretty good. There probably are a few, look, we've got tens of millions of cases of this. So there are certainly probably some people who didn't develop symptoms until a little bit later than that. But the vast majority of people will be developing symptoms within that 2 to 14 day period. 14 is probably a little actually long, but we will certainly be seeing the vast majority of the folks who are going to develop symptoms or be infectious will be so during that 2 to 14 day period. Now, once somebody becomes ill with the virus, they may continue to shed active virus while they are ill for an extended period of time. So that's for those folks who do become ill, that period now extends fairly and may extend fairly dramatically. There are people who have been hospitalized with active disease for months. So once people become ill, it's a little bit of a different question. But for those folks who either recover from their illness or who don't become ill at all, that 2 to 14 day is probably going to be pretty good.
Thank you. Other questions, guys? Raise your hand or unmute. Keith again.
Yeah, I've got one more question here. So with the numbers going up like they are, how realistic is it to think that we could actually have high holiday services in shul this year?
So what Rabbi Heller is fond of saying, and I will reiterate here, is that we will not have anyone sitting near the ice machine this year.
Or that may be the only place they're sitting.
No, you're right. And in addition to sitting on the ritual committee and on the task force for COVID-19, I am also on the High Holiday Planning Committee, and we are desperately, we are working very hard to figure out what we can do. Obviously, what we are doing now, we can do. All right, so we will be able to have a fairly significant and meaningful virtual service. Beyond that, we are working on it, and we're working hard on it. As many of you know, you got a survey that we had a terrific response to. Probably close to half of our families responded to the survey, and that's informing a lot of what we're doing. We're trying to use what people have expressed as their own preferences, their own concerns, their own interests, and trying to use that to plan a high holiday service that will be meaningful and spiritually rewarding, even if we're not all in the same place. I will tell you, and I hope I don't think that I'm spoiling anything by saying it. We've got some things that we are planning, that we are considering, and that we are probably going to be putting into place that I think everyone will want again next year. That there will be some things that we do this year because we have to, that we will do again next year because everybody really liked them. So you will see some things that we do this year that it's all going to be very, very different. It's not going to look at all like it did last year. But I will tell you that next year will not look like last year either, because a lot of the things that we are doing this year will be so positively received that I think people will want to do them every year.
Yeah, never let a good crisis go to waste. I think, we don't want to get people disappointed by saying we're going to do X and then we don't. But I think what we are going to offer virtually will meet the needs of what people told us in the survey for the most part. And what we're able to do in person will really be dictated by where the virus goes. We're working on those plans, but again, to get people to sign up for something that then turns out we can't do doesn't really benefit anyone. So we're working on kind of the whole menu and reaching people in a lot of different ways. We've increased when I got here, there was one flavor of high holiday service. And then we added the additional service that Rabbi K leads. And then, we sort of built up youth services. And then we added the essential service in the afternoon and Tot Kol Nidre. I think the way this year goes may give us the chance to meet a lot more needs than we have before. And we just have to be limited by what we can do safely.
Thank you. Other questions, guys?
I think Fred's cat has a question.
No, we will.
It's not even my cat.
We will. Our rule of no pets in the shul will maintain. Just noting. Other questions, guys? I'm scrolling to make sure I don't miss anybody.
I do want to make sure, look, I have had conversations one-on-one with a lot of congregants, and I want to make sure that people are aware that I'm available for that. If you have a question that I can answer as part of either a congregational response, or you just want to know why, why is this politician or this scientist saying this, and this other politician, this other scientist is saying the exact opposite, and they both seem really confident about it. I'm more than happy to have conversations like that. I think I'm scheduled, Natalie, if I'm not mistaken, to actually be on a I forget what it's called. What is the?
I'm going to ask Golda to help me out, but it is a boomers speaking engagement in early August.
Yeah. So I don't know exactly what we're calling it, but it's basically, everything you wanted to know about COVID-19, but we're afraid to ask. Is that Golda's like, yeah, well, yeah, good. Hey, we'll name it that.
Call it that.
But so I do, we will have opportunities again to discuss some of these things, but I do want to let people know, look, if we were having services, you would have an opportunity to corral me and to ask these questions. I want you to still have that opportunity to corral me and ask those questions. If there are things that you want to know, you can get in touch with me. I will give you the sneaky trick is go to our Minion webpage, and at the bottom of the page is a link to my email. So that's the easy way to find me. If you want to make it a little bit harder, call the shul and they'll track me down. I'm not going anywhere.
Or show up at Minion any day.
show up on Sunday mornings or afternoons, and I will be at Minion, or Shabbos mornings. I will also be there, but I am more than happy to answer anybody's questions. And look, I'm also up for a healthy debate about different things. And I've had a few of those with some of our more debate centric colleagues. So.
Great. I don't want anyone to feel like they got left off, but I also respect that some of you may have some questions that you don't want to ask to the greater group. And if that is the case, like Mitch mentioned, you are welcome to email him directly. You can email Roger, myself, Rabbi Heller, and we will make sure to get your question answered appropriately. As we mentioned earlier, we will keep you all apprised of decisions related to the high holidays. Our educational wings, both preschool and religious school, those communities will be brought into the loop as decisions are made related to them. And obviously, as we adjust phases forward or backwards, we're going to let y'all know what that means for the community. But just, I think, to close on something Roger hit on in the beginning, we are not closed. We are doing really amazing spiritual stuff. We are doing educational stuff. We're doing fun programming. And so I really encourage each of you, albeit different, to really engage with us in one of those ways. And I hope that will fill a little bit of your need and a little bit of your B'nai Torah community until we can be back together. Rabbi Heller, Roger, anything final before we close?
I just want to say thank you. This task force is amazing. You guys, these people, volunteers, have day jobs which have been very stressful, dealing with COVID in their day jobs, and they have given. Sunday night, we start at 9 and we finish at 11 p.m. And really, really do their best to educate us, guide us, and help us make smart choices when a lot of other people, frankly, if I were left my own devices, we'd be doing a lot of dumb things. So really, it's good that we have smart people guiding us, because there are definitely churches and other houses of worship and even synagogues out there that they're just a matter of time before something goes really wrong. And it's frustrating, but sometimes doing the right thing is often the harder thing.
Great. We hope you all stay safe and healthy, and we hope we will see you on one of the upcoming Zoom opportunities. And thank you all for spending a little bit of your Tuesday night with us. Bye, guys.
Good night.
Thank you for having this.
Thank you.
Thank you.
Yeah, enjoy it.
Thank you.
Thank you for your
It's very
diligence in
helpful.
taking care of us.
Wonderful.
Thank you.
Thank you, everybody. Oh, Judy call. Judy. I mean.
What did you say, Jay?
Ralph.
He's naughty, isn't he?
What can I say? It goes with the territory. Thank you, Roger. This was great.
Thank you.
Good night, everyone.
Good night.
We are closing.
Thank you, Rabbi.
So say your goodbyes.
Lila Tov.
3, 2.
Thank you, Mitch.
Good night.
Thanks, Ralph.
Thank you, Rabbi.